Very much, and I want to thank the organizers for inviting me to talk about obstetric point of care training of primary health care professionals in Kenya. And as my name you've heard, it's Gladys Mwango. So in terms of the WHO guidelines, they recommend the use of standard ultrasound services to all pregnant mothers, and in Kenya, we've had some policies which have been made to align with this recommendation. So the Ministry of Health in Kenya, through its partners, developed the national OPOCAS guidelines, as well as the OPOCAS training package to improve ultrasound access in the underserved areas. And they're using OPOCAS to be a high-impact intervention, as it enables early, timely decision-making by the primary healthcare professional. So in terms of how the national OPOCAS guidelines were developed, they use the normal standardized operating procedures which have been described, and they involved the following. They identified what were the priority questions, they retrieved the evidence and synthesized that, they assessed the evidence and graded it, and as well as formulated the recommendation. And then after that, the guidelines have been disseminated. And going forward, and this is the guideline that was now rolled out last year, and it explains who is to be trained. It is a cross-cadre training, which involves the midwives, the nurses who have midwifery skills, the clinical officers, the medical practitioners, and as well as the imaging staff. So for us, the radiographers, sonographers, sonologists, radiologists are being trained to ensure they keep within the scope, they don't go outside the scope. And the recommendations are to do, which are the recommendations of when we are going to do the OPOCAS, at the different stages of pregnancy, and the training, the need of it to be standardized, and that's why there was a need of a standardized training curricula, and as well as the specification of the equipment that will be used to perform the OPOCAS. So that is the OPOCAS training package in which we were involved in the development of it. And the overall purpose of the OPOCAS training is to ensure that the healthcare worker has the necessary skills, attitude, knowledge, and competencies for safe OPOCAS utilization within their respective scope of practice. So they have to keep within their scope of practice. So only 6 parameters have been assessed, and this is the gestational dating, the cardiac activity in terms of the fetal heart rate, to localize the placenta, amniotic fluid assessment, and this through doing a single deepest vertical pocket, multiple pregnancy to see how many fetuses are there in situ, and as well as a presentation and live. And the training modules, there are 6 in total: basic concepts, physics, the overview scan, the key measurements, they need to understand the ethics of it, and also how to do the monitoring and evaluation. Very key is that OPOCAS is not replacing the standard ultrasound, and it's defined as that ultrasound imaging performed by the healthcare provider to optimize their clinical examination. It does not attract any additional cost. There are no images which are being retained unless they're only being retained for quality assurance, and there is no report that is going to be issued. All they have is a reporting template for them to look at the 6 parameters. So we've done a few pilot testings in order to look at which will be the best training model. Initially, it was fully face-to-face, and then we did a blended method, and the outcomes is, as can be seen on the slide. And in terms of the recommendation from the pilot trainings, it was seen that the blended method actually had much better results. And there was a need to increase the hands-on training to a minimum of 5 days. Initially, it was just 3 days hands-on training, plus the need of having a well-designed support supervision and a mentorship model to ensure that there's effectiveness in the practice. So this is now the training model that we have adopted in terms of there's going to be online training for 3 hours per day, and that's for only 5 days. And then after that, we do the pre and post test. We have theory in the mornings until around 10 a.m. After that, they go on and do hands-on. And on the last day, they do an OSCE, and that gives them 51 hours of the training. And then after the remaining 130 hours, the support supervision training. And the tests that were done using that model were quite good, the pre and the post-test results. So I've talked about there being an opacus finding template, and this is what is going to be used, whereby they just tick. What are the number of fetuses? If it's 1, it's a yes or no, with the location of the placenta, the fetal presentation, the fetal lie, the single deepest vertical pocket, fetal heart rate, and fetal biometrics. And if there's any no in it, then that means they have to refer the patient for a standard ultrasound scan. And the hope is that through this, we shall be able to have more patients coming to do a standard ultrasound scan, and the access to proper ultrasound scan will be increased within our country. So the indications for referral are as follows: is where they do not find a gestational sac within the uterus, where the fetal number is more than 1 in breech presentation, fetal lie other than longitudinal, if the fetal heart rate is outside that range, non-fundal placental location, SDVP again outside that range, and if the mother comes with any complaints or if there have been any abnormal findings during the scan. Of course, there are some quality assurance mechanisms in terms of ensuring that we have a standardized curriculum, training, the supervision, and we have a supervision model that is now being used, which is online, and as well as continuous monitoring. So what have been our achievements? So far, we've trained 100 healthcare workers. There's been quite good partner engagement and facilitation. We've received quite a bit of support. There's been multidisciplinary in terms of the radiologists are becoming much more involved in what happens within the reproductive healthcare space, and there's been increased identification of high-risk pregnancies. In terms of, we found when we've done our training out there, we've been able to identify HMOL, we've been able to identify mothers coming in labor when already they have multiple pregnancies, which were now discovered at that time, or having a breech presentation in labor. So the challenges, the main challenges have been the equipment availability in terms of the functionality, the maintenance. Mentorship is important. Sometimes we don't have adequate training, and the M&E. So I want to thank you so much, and that comes to the end of my presentation. And I'd like to acknowledge the following. Thank you.
Thank you, Dr. Gladys, for your nice talk.